beg to move that this House do now adjourn.
The question is that this House do now adjourn, and we have Abena, Oppong-Asare on endometriosis, fibroids and women's health strategy. Mrs.
Thank you, Madam Deputy Speaker. Endometriosis, fibroids and related gynecological conditions ruin lives of millions of women. Yet these conditions remain undiagnosed, misdiagnosed, dismissed or mistreated within the health system. Women are told to shut up and stop complaining. We are fobbed off. We experience shameful delays. We are left in pain. So my argument today is simple. We need the forthcoming women's health strategy to address head on these conditions, listen to women, tackle the taboos, and create a timely and effective treatment. 1 in 10 women suffer from endometriosis. It is a painful and debilitating condition in every community, in every workplace, in every family. 1 in 10 means at least 20 women members in current Parliament. Despite being widespread, it remains misunderstood and dismissed, yet it ruins women's ability to learn, to earn, to have sex, to have children, and live a normal, healthy life. It literally destroys mental health. There's been greater awareness in recent years and a wider discussion about the impact of these conditions led by public figures such as BBC's Emma Barnett. And this year's BAFTA-winning short film, This is Endometriosis, which I hope to be hosting a screening of here in Parliament soon. And in this House, I also commend the great work of the Chair of the APPG, the Member for Bath Kate and Lynn Lithgow, as well as the Chair of the Women and Equality Select Committee, the Member for Luton North. Yet millions of women are still being failed by the NHS and wider society. There's literally still a lack of appreciation of the true nature of the disease, suitable support throughout the worlds of education and work, and stigma associated with the symptoms such as heavy bleeding and intense blinding pain. The average wait for diagnosis is 9 years and 4 months, according to the latest report launched this week by the charity Endometriosis UK. Yet the report highlights that diagnosis times are not getting better, they're actually getting worse. This March is Endometriosis Action Month. It is therefore vital that we use this opportunity to act now for the benefit of those suffering today and long into the future. And in a moment. And sadly, even with this diagnosis, there is no cure, just pain management. I'll give way.
I thank the honourable member for giving way and for taking some time out of her very passionate speech about the huge numbers of women who suffer from endometriosis. Given the challenges with diagnosis she's outlined and the enormous pain and suffering, does she agree that far more money and government support needs to go into research so that we can better understand this condition and how to diagnose and treat it?
I'd like to thank the Honourable Member for raising this, and it's nice to have a male ally in the Chamber raising this. In fact, a few male allies here. I think it goes wider than that, because obviously the government is looking to publish the Women's Health Strategy quite soon, and I'm going to talk about this in detail. The data is already out there in terms of what the delays are. In fact, it's about recognising the signs and actually making sure that people get the adequate help that they need. And I will talk about this in detail, about some of the stuff that I've done, particularly in my constituency, that also highlights this. It's often been said, but worth repeating, that if these conditions were suffered by 1 in 10 men, there would be research into cure, fast diagnosis, effective treatment, time off work, and a sympathetic, understanding reaction from all the other men. If only women got the same reaction at work within the health system. Endometriosis UK found that 39% of the respondents had to visit their GP 10 or more times before endometriosis was suspected, and 46% were sent home from hospital without treatment. This is simply outrageous, and this leads to, in response to the point that the Honourable Member opposite raised, in terms of the fact that people are visiting GPs repeatedly before even being recognised that they have that condition. So when I surveyed my constituents, one told me I had to go to my GP 3 times and leave an utterly desperate comment begging for help until they took me seriously. Another said it was a condition I'd never ever heard of until it started to affect me. And another said the pain was so excruciating that it felt worse than birth pain. This is just so common, and this is the experience of millions of women down the decades. And I also want to say that women of colour suffer the double whammy of facing misogyny within the NHS, as well as racism that tells you we have a higher threshold to pain, or that black women can handle it. The recent interim report on maternity services by Baroness Amos last week highlighted the structural racism within the NHS, which essentially leads to worse health outcomes for women of colour. The Endometriosis UK report says that women of colour, the average wait for diagnosis is now 11 years. 11 years. That is grave injustice. So it's not just a question of equitable health provision, it's also a question of social justice for women. Madam Deputy Speaker, it of course makes no sense that within the NHS, with stretched resources and overworked staff, to the millions of women repeatedly presenting with their symptoms, being sent away, returning in pain, making complaints for years on end. Getting it right the first time matters. So I do welcome the new NHS Online, a virtual hospital in England, which is due to launch next year in 2027. Menstrual health conditions, including endometriosis, will be one of the priority areas. NHS Online Hospital will use the NHS app to triage patients and provide fast access to specialist clinicians online. Where needed, specialists will be able to arrange local testing for women. I invite the Minister to comment further on how the NHS Online will help women with these conditions. The forthcoming Women's Health Strategy affords us a huge opportunity to move forward. I know the Minister will not be divulging the contents to this House today. I know we have to wait to read the strategy in full, but I know that both the Minister and her ministerial colleague in the other place who is responsible for women's health get it. She knows that a range of conditions affecting so many millions must be front and centre in the strategy. The strategy must address early diagnosis and faster and effective treatment. It must tackle the stigma and taboos. Most of all, it must address the way doctors are trained so that endometriosis and also fibroids and similar conditions are identified fast. We have made a great progress on sepsis, for example, in early identification. We must also do the same for endometriosis and fibroids. Will the Minister give us assurance that training for doctors will form a key part of the strategy? Will she work with the Royal College of GPs and the NHS training providers to ensure that these conditions are central to the syllabus? That every newly qualified doctor has knowledge to identify endometriosis when a woman presents with these symptoms. Earlier diagnosis means early treatment, and that saves a huge amount of pain, dismay, and taxpayers' cash down the line. It really is a common sense approach, given the huge number of women involved. I long for the day when we have a cure with proper medical research, as the Honourable Member opposite has also alluded to, and I'm sure that this day will come. In the meantime, will the Minister agree with me that women should not be waiting years in unnecessary pain, and that the Women's Health Strategy can and must offer women in pain a real sense of hope? Thank you, Madam Deputy Speaker.
I call the Minister again. Minister Karin.
Thank you, Madam Deputy Speaker. And can I congratulate my honourable friend member for Erith and Thamesmead on securing this important debate. And I'm grateful to her, as I know my friend, the Baroness Merron, who leads on this work for the department, is really grateful for the conversations that she has been leading on this and putting the spotlight on this particular endometriosis, but also the renewed women's health strategy, and giving me the opportunity to set out what the government is doing in this Endometriosis Action Month. Because, as she has said, for far too long, women with gynecological conditions, including endometriosis and fibroids, have been failed, and we acknowledge the impact it has on all aspects of their lives. And this government's message to women is clear: you do not have to put up with this anymore. And I'm pleased to hear that she will be hosting a screening of the short film This is Endometriosis, about the harrowing experience of a woman seeking care for her endometriosis symptoms. I hope to be able to get along to that when she does that, and I encourage everyone to do that. Madam Deputy Speaker, we inherited a broken NHS where many women are still the subject to a system that doesn't understand our needs and wasn't designed with women in mind. And we are committed to changing this, ensuring that women are listened to and get the health care that they need when they need it. And improving awareness of endometriosis, fibroids and other women's health conditions is a vital first step in our commitment to end this neglect of women's health and reduce the stigma that's attached to it. And the Honourable Lady is doing her part through the debate this evening. The General Medical Council has begun work to improve women's health representation in the curricula and used to train healthcare professionals. For example, since last year, students graduating from UK medical schools are required to pass the medical licensing assessment, which encourages a better understanding of common women's health problems among all doctors as they start their careers in the UK. And this assessment includes topics on women's health, including endometriosis and fibroids. Women's health is included in the Royal College of General Practitioners curriculum for trainee GPs, and a women's health library which brings together educational resources and guidelines on women's health. In November 2024, the National Institute for Health and Care Excellence updated its guidelines on endometriosis to make recommendations for healthcare professionals on referral and investigations for women with suspected diagnosis. And taken together, I do think these actions will improve the standard of care that women receive. And I think it's encouraging to see not just the NHS taking action to raise awareness and improve training, but all our partners in arm's length bodies too. And this work has to be ongoing across government. It is shocking, perhaps, that that's fairly recent starting, but I would pay tribute to many, as I know she would, many honourable members across all sides of this House, Madam Deputy Speaker, who have led an awful lot of work to raise awareness of this in the last few parliaments, and I think it is starting to bear fruit. In July last year, the Department of Education published revised statutory guidance which sets out in black and white how secondary schools should cover menstrual and gynecological health, covering things like heavy bleeding and when to seek help from professionals. We know that women often spend years being dismissed, misdiagnosed or simply not being listened to, and this has also been reflected in Endometriosis UK recent report which my honourable friend has made reference to. And we are clear this is unacceptable and women should not have to put up with it anymore. We've introduced Jess's rule that requires GPs to rethink diagnosis for their patients. We're rolling out Martha's rule, which will give inpatients in acute hospitals in England the ability to initiate a rapid review of their case from someone outside of their immediate care. And these will help make sure women are listened to by their doctors and their concerns aren't dismissed. Now, early diagnosis is also key, and that's why we continue to roll out community diagnostic centres across the country for women on gynaecological pathways. As of last month, 106 community diagnostic centres across the country now offer an out-of-hours service, 12 hours a day, 7 days a week, meaning patients can access vital diagnostic tests around busy working lives. And in September, we have announced a new online hospital called NHS Online to give women on certain pathways the choice of getting the specialist care they need from their home. And what this means is that wherever women live in the country, they can have access to the very best gynecological care. And earlier this year, we announced that menstrual problems, which may be a sign of endometriosis and fibroids, will be among the first 9 conditions available for referral from 2027. And the detail is being worked through ahead of the launch next year. Our revolutionary online hospital will help reduce patient waiting times, deliver the equivalent of up to 8.5 million appointments and assessments in its first 3 years, 4 times more than an average trust, while giving women choice and control over their care. And finally, this government are committed to encouraging ICBs to further expand women's healthcare and women's health hubs at a neighbourhood level and support ICBs to learn from women's health hub pilots to improve the services for women as well as the rest of the population. Now, Madam Deputy Speaker, we know that women can be impacted by a range of different health conditions at the same time, including those that not only affect women, those that affect women differently or more severely to men, and those that affect different groups. We know this is the case for fibroids, as she has outlined, particularly where black women disproportionately affected and often face barriers to timely, compassionate care. And as my honourable friend has raised, this is also the case for ethnically diverse women with endometriosis, as highlighted in the Endometriosis UK report. We're not complacent about these inequalities. We are committed to building a fairer Britain to ensure people can live well for longer and spend less time in ill health. And the 10-year plan will shift how we will focus that care from hospital into communities and how neighbourhood delivery can help adapt the gaps in that provision and those long waiting times, specifically for those for deprived areas like constituencies like mine and women from an ethnic minority background. And can I just add, Madam Deputy Speaker, to the honourable gentleman who raised about research, we should also add that the department, through the NIHR, has commissioned several studies focused on endometriosis diagnosis, treatment and patient experience, and at present they are funding 7 active research awards totalling an investment of £7.8 million. This includes a new £2.3 million award on the effectiveness of pain management for endometriosis starting in March 2026. So, as my honourable friend has raised this important debate, we know that services are not serving women as they need to right now. I think there are some really helpful starting signs that is starting to change. Training awareness is a key part of that. We need to keep highlighting the differences as women present for care. We will listen to women, and I look forward to working with her and others on developing and implementing the renewed women's health strategy over the coming months.
The question is, this House to now adjourn. As many that opinion say aye? The ayes have it. The ayes have it. Order, order.